Welcome to another AAPA PANCE PANRE review quick case. My name's Paul John. This is John Maybe.
Hi.
And let's get to today's question.
Right.
So, a 50-year-old Caucasian man comes to the office for his yearly checkup. He's been well since his last visit and has no complaints. He has no medical conditions, doesn't take any medications. Both of his parents are alive and well. There's no family history of any medical condition. He's never smoked cigarettes and drinks about a half a glass of wine daily with dinner for the past 3 years. He still owns his own architect business where he's worked for the past 20 years. So in this patient with average risk factors, which of the following cancer screening tests is most appropriate for this patient's age? A, colonoscopy, B, digital rectal exam, C, low-dose CT scan of the chest, D, prostate-specific antigen, or E, testicular palpation. John, what's the answer? Yeah, what's the answer and what kind of question is this?
Yeah. So the answer is colonoscopy, option A.
Okay.
So the kind of question this is actually, it falls under this category of health maintenance type of question. So here we're looking at, can you identify like risk factors? Do you know like the preventive, interventions that need to be done, to help sort out those or stratify people's risk factors? So with respect to this answer, let's take a look at this table, colon cancer screening. So this is something that begins by most organizations. They use the age of 50 as a threshold for determining when someone needs to start that process. There are some organizations that advocate for age 45 years of age in individuals of African-American descent. So there's a little variation on this. But with respect to test items, if you get a question that's asking for this, it'll be very clear. So with respect to colon cancer screening, we talk about tests that are like the bestest, kind of tests. And then we talk about tests that are, fair alternatives. So the tests that are considered best tests are really tests that detect both cancer and also the presence of polyps,
Makes sense. Okay.
Versus the other tests really can only detect the presence of cancers and typically like they're shedding cells or hemorrhagic somehow. So those best tests are these first three that are listed here. Flexible sigmoidoscopy, so every 5 years as one option, or colonoscopy every 10 years as another option. And then the third option here is virtual CT colonoscopy every 5 years.
Okay.
And would you have a preference for those?
There's one that sticks out very, very clearly for me. I'll be honest. Yeah.
So we leave it up to patients to make their own decisions on that. The other options, the last three that are listed here, fecal occult blood testing every year, or fecal immunochemical tests every year, or as a third option to that, stool DNA every 3 years.
Okay, the stool DNA, I gotta stop you there for a second because right now in my mind I see a person in a lab coat with goggles on and a pipette, and they're literally pipetting like stool samples and feces into like PCR dishes or whatever. I can't imagine like, what did you do to deserve that?
What kind of person does that?
My life, what does my life come to? I'm pipetting feces.
Having said that, I miss working in the lab back in the day.
All right, so what about the other answer choices?
Sure. So let's take a look at these other options. So the other options were like digital rectal exam. So this is not really recommended as a screening tool for prostate cancer or as a standalone test. There have been multiple studies that have shown no change really in morbidity and mortality over the course of time if the diagnosis is made by doing digital rectal exam.
Dodge a bullet there.
Right. Low-dose CT scanning of the chest. So again, this is a USPSTF criteria, and there's the criteria about this with smokers.
Yeah, I remember it's the age between 55 and 80, and you have to have high risk as far as the smoking burden. So it's a 30-pack year history, and you're either actively smoking or you have recently quit within the past 15 years. Those are the ones who are at higher risk that the USPSTF recommend doing this low-dose CT scan annually. That's crazy.
Yeah.
How about the PSA or prostate-specific antigen? Controversial.
Right, exactly. So prostate-specific antigen. So the USPSTF, again, recommends against using a PSA as a routine screening process just because, we end up kind of picking up disease that's either slow-growing or non-invasive. So you end up having, complications from being worked up.
This is like that classic one where it's like the risk-benefit kind of weighing thing because, like you said, the PSA, it's an overly sensitive test, and they might detect asymptomatic prostate cancers that would have taken a lot longer to even progress or not even progress at all. And now you're doing all this invasive testing and treatment, and they might have ended up dying for other reasons.
Exactly. That's why these types of criteria are developed.
Yeah.
And along that line, same thing for the last one, testicular palpation. Again, the USPSTF does not recommend testicular palpation in adolescents and adult men. So again, these are literature, evidence-based derived thresholds. So important to know for test-taking purposes.
Awesome. Well, that wraps it up for this quick case. We'll see you next time.
All right.